Hi friends, the moment we are diagnosed with an ailment, we get so much advice from people who know us, right from our parents to our friends to those who even remotely know us. And then we are already struggling with the diagnosis and the test and the thing, and we are so stressed out. And then there are people who will confuse you more with alternate therapies, holistic methods, and a lot of options, and that confuses and scares you all the more. The point is, and then you get so confused, like what is to be done. People scare you that if you take allopathy, this and this will happen, and then they say that if you follow this alternate method, you will be saved from this, and these are the benefits. I agree that there are several alternate methods. There are various methods available out there to treat an ailment, right from herbal to Ayurveda to homeopathy to allopathy to a lot of some Chinese methods to acupuncture to acupressure to a lot of other natural methods. But the point is, when we are supposed to choose what? There are a lot of ailments or small problems wherein it is seen that natural remedies work, like right from common cold to a virus to flu to skin eruptions, or it could be any problem, and it works. Well, there are a lot of methods out there, but there are times when you need to choose the known and tested method which are available in allopathy. You cannot risk having a tumor in your body and say that I will cure it with Ayurveda or juicing or some other thing. You need to choose logical solutions to your ailment. So suppose you are having a heart attack, or the doctor advises you to go for a bypass and or angioplasty, whatever, then you need to go for it. There may be alternate methods, but the thing is, how much will you be able, how much dedication will you be able to put into that kind of treatment? I agree, and I'm not denying that alternate methods do not help, बट हम कितनी शिद्दत के साथ आप कर सकते हो वो, हाउ मच डेडिकेशन कैन यू पुट इनटू दैट टू एंश्योर दैट यू आर फुल्ली क्योर्ड. We are all, I mean, especially people in the cities, we have so much, we're busy people, we have something or the other, lifestyles are different. Of course, lifestyle is one of the reasons a lot of ailments exist, but the thing is, you need to choose logically. I know of patients who, like, even when they have had tumors, there are some nutritionists, some naturopaths who advise that it's okay, or some even other, I do not want to name any special field of medicine. Then they tell you that don't worry, we will treat you by this, and then their conditions worsen because the patient is not able to endure it or do it with that much dedication as he's required to do it. I know of a case wherein a lady was diagnosed with a tumor in her breast. However, she refused to undergo any operation, saying that she will rely on Ayurveda to have that the tumor reduced or removed. I understand, but as far as my experience goes, Ayurveda does not suit every body. Bodies, I actually mean the body, because my experiences with Ayurveda have been that it has not suited me right from childhood. Whenever I have something Ayurvedic, this, because Ayurveda actually means something, those dried herbs and plants, concoctions, and that can, and they are very heat nature, so like they induce a lot of heat in your body. And if your body prakriti, or say that body type, is in a certain way, then you are not able to sustain that much heat in your body. So I have always preferred Ayurveda for my external application, herbal and Ayurvedic methods for external applications, skin rashes or whatever, or boils and tans and all. For that, it works fine. But there are some people for whom certain medicines do not suit. So telling them to with that kind of medication will not help. So do not advise, people should not advise others unless they know of their conditions. Should leave them to the experts or let them decide. And to the patients, I would say that listen to everyone but follow your heart. Take advice of some neutral doctors. There are certain allopathic doctors who have a lot of experience, and they have done studies of alternate medicine also, and they will give you right advice. Like suppose somebody has a heart attack or is advised to go for bypass, do not tell them कि अरे ये दवा खाने से, or you make a concoction of this and that and it will become all right. I've seen like many years back, my dad was told to go for bypass surgery, and a lot of people came forward dissuading him from going for the surgery, and we were also skeptical. So then, and he was also, of course, it's a very big surgery and the people are scared to go under the knife, and then a lot of people came forward saying that ये ऐसा काढ़ा बना के पियो, वैसा काढ़ा बना के पियो and you will be fine. But whom are you, like, I mean, you cannot play with such things, I mean, such critical things and such critical ailments. And then my dad said that he would like to take the advice of a very renowned heart surgeon, Dr. Panda, and when he said that, of course, you will have to go under the knife, or you have to undergo that surgery. Only then did he opt for the surgery. And after the surgery also, angioplasty is different. You get well on your feet much before than a bypass surgery, because if you undergo a bypass surgery, so you should also have a caregiver. Like that time, my mom, the way she used to take care of him, it's really commendable, because you have a cut. I think your ribs are also cut through. I mean, that plaster is there. You have to really take care of yourself. It's very important that you have a very good caregiver. It's not only the patient. To fully recover, you need people around you who are supportive. So it's like people cannot get well on their own. You need to have an environment, a supportive group around you. And for a lot of ailments, and over a period of time, I've studied a lot of, because of my own health issues also, I have actually got the time to study a lot of things about different type of medicines. I know about nutritionists advising naturopathy and homeopathy and a lot of others. I have not got into the details of acupuncture, acupressure and all that, but I'm sure they are also good methods. But for me, what works is allopathy. I have a lot of trust in allopathy as well as homeopathy. So for certain ailments, you have to take the help of allopathy. Do not get carried away. Even if it is a surgery, maybe surgery that time seems like a big thing to you, but once you're through it, you within a few months you will be fine. And among the alternate methods, I have seen that homeopathy works fine. And I trust homeopathy more because it gets into the each and every cellular aspect of your body and then repairs it. And the best thing about homeopathy is that it works in tandem with your allopathy, because allopathy homeopathy studies allopathy and designs their medicines based on that, because the patients who come to them come as a last resort, that nothing is working for them, or they are having a lot of side effects of allopathy, and then they approach a homeopathy doctor. So sometimes both in tandem work, because some side effects which come through from allopathy can be managed by homeopathy. So that in tandem works. And of course, I'm not saying that herbal things do not. You have to have that herbal and nutrition and all are supplements to your actual treatment. You cannot just say that मैं खा पी के ठीक हो जाऊँगा, because we have to cure ourselves. So of course, apart from choosing the right method of medication for yourself, you also have to see that you eat good. I mean, have a lot of raw fruits and vegetables, salads, and all these are very good options for any kind of ailment. And the balanced diet is very important. And by balanced diet, I mean that you need to have a little bit of everything. See a nutritionist. But why I avoid nutritionists is like, because some nutritionists try to, I mean, some of the Indian nutritionists I have seen, they try to promote vegan. They have a different agenda altogether. They say nutritionists, but they actually promote vegetable, some plant-based food therapy, something like that. And remember that no matter which kind medication or field you use, if you do not like it or detest it, it will not work for you. You need to have belief in your medicine and your doctor. Then only it will work fine for you. I mean, I'm not supporting any kind of medication, but I wanted to make this video to make people aware. There are good and the bad sides of both holistic and allopathy. And holistic approach should be your approach. Like, you have to give up all refined things. You have to eat more of vegetables and fruits, and include even nuts. Everything should be included in your diet, but you should have little of everything. You should not undereat, you should not overeat. And the most important thing is like our lifestyles, a fast, hectic, stressed lifestyles are the main cause which make us ill. I mean, so you should try to remain away from stress. You should look first into your life. So whatever you are today is what has happened in the previous 6 months. So you should look back, reflect on the previous 6 months to 1 year, and see what has changed in your life that has made you more stressful. And if possible, try to stay away from those things. And if you can identify negative people or negative things in your life which you need to stay away from, do that. It could be a negative work situation with your boss or your family. So change the department, change your work environment, change your home environment. If you have to stay away from certain people for your peace of mind, do that. Because at the end of it, your health matters. There are sometimes chronic ailments which you can cure by staying away from all these things, improving your lifestyle, eating good food, and of course the medication. The reason why allopathy is people do not like allopathy is because of the current doctors. It is not because of the studies. I have seen, like, my experiences in the past few years with doctors. I have seen that allopathy doctors have become sort of insensitive. I mean, they have so many patients. They are more driven by money making. I mean, and when a certain person has been diagnosed with something, then the support and care and the consolation that is supposed to be given, that is not given. For them, you're most like a number, like next, next, and they have decided that they'll give you only 2-3 minutes at the most. So they do not try to delve into your psychological aspect and the reason behind the reason why you have got that ailment, and that if they take that trouble too, because nowadays you see doctors. I remember as a child when I grew up, we used to have a doctor called Dr. Banker, YG Banker, as kids when we used to stay at Bombay Central RBI quarters. And first he was a doctor with RBI, and then he had a separate practice. Even he retired and he was quite old, and he used to just look at the patient, speak to that patient, and he used to tell, he would give the medicine. But nowadays we see doctors like most of the doctors. I mean, there are doctors like that today also. Like they are so experienced and they are so well versed with their profession that is by speaking to you and interacting with you and knowing your symptoms, they will tell you whether the ailment is just in your mind or you actually have that ailment, and they will direct you to the right tests, and they will advise test only if it is necessary. But nowadays we see that these doctors themselves are reliant on the tests, so they will not diagnose you. They will just tell you ये टेस्ट करो वो टेस्ट करो. अगर टेस्ट ही करना है तो we will do all the tests ना. टेस्ट करने के बाद तो even the patient nowadays, if you see the test and you compare it with a lot of information available online, you can do self-diagnosis. So let's not get into that. But the problem is, the reason for saying this was allopathy बदनाम इसकी वजह से. Medicine as such is not wrong, but the doctors have become like that, and then we have got into the habit of just blaming allopathy is bad, allopathy is bad. I'm not saying it's bad. All kind of medication, all kinds of fields of medication are good. Medicines are good, and there are a lot of medicines for which we need not have tablets and all the chemical composition and syrups and all that. Wherever you can avoid that, go for alternate methods like herbal. And I don't want to actually discuss that information is available, or you can visit some naturopath or herbal ayurvedic doctor, whatever suits you. But the point of saying this was that everything doesn't suit everyone, and then you should sometimes you can do a combination. Of course, you, apart from taking your medication, you have to also make changes in your lifestyle and temperament. And like I had a discussion with a very nice doctor from Jodhpur, Dr. Arun Acharya, yesterday, and we were speaking about allopathy versus other medications, and he said yes, allopathy has existed with a lot of so much research and not, but people generally say things about it. And of course he also follows, advises other methods. He has retired now, he's gone to Jodhpur and all, and we had a nice discussion, and he said that finally, and like I have also seen that finally it is your state of mind. Your my challenges with my health have taught me one thing. I mean, it has changed me as a person. I have got into and studied so many things, mind sciences, like Dr. Louis Hayes' book, that you can cure yourself, has taught me that there is an emotional, there is always something, some emotional thing, some kind of emotional thing attached to some kind of, suppose like the fear say this kind of this happens, this kind of, I don't have a list and all, but if you read her book you will understand that there is some emotional connect to all kinds of disease. Like if it is a bone issue, then it must be because of some this emotional thing and emotional, and for that she has given very nicely in her book a lot of affirmations. Like if you have fear, so fear is linked to your stomach, and if you read the book you will come to know. I just don't want to discuss that. If I have the book in my hand, surely I will try to discuss that as a in a separate video. But the thing of making this video was to save lives, because I have seen that a lot of people post generic things, like a lot of nutritionists and even some naturopaths also. They say that they just post generic videos about ailments, and they do not put disclaimers and all. Okay, if you have this ailment, please consult a doctor and all. So when those disclaimers are not there, so it happens a lot of time that people think that okay, इसके लिए तो इलाज है, so they give up or they stop taking medication, and then they feel कि ये, and the people are also so smart, they will not consult that whoever has advised them, show their reports and then take a proper, they just go by these videos and then they start doing a self cure thing. And जब तक मन करे they will take those medicines also, and then finally you're not taking the allopathy thing also, you're not taking the other thing also, you're just doing self diagnosis, that self medication, and that can be harmful to you. You should always take any type of medication, even if you're taking herbal thing or a homeopathy or a ayurvedic thing, ayurvedic medicine also. Don't just take it over the counter. Consult a proper ayurvedic doctor or a homeopathy doctor, or even naturopathy. Maybe if you're going for any kind of hijama or acupressure, properly you visit a proper doctor, show them your reports, and then only start your treatment. And do not just watch some video and start your own treatment, because that's not going to help you. The reason for making this video was that only, because and then because I have seen, I've recently also I was part of some group, and there are also I have seen people post things, and then people do not know how much you can effort you can put into that. If somebody is monitoring you, it's a different thing, but do not leave your medication just because you have come to know about an alternate therapy. Even if you're taking that alternate therapy, then you should have a proper doctor with proper degree monitoring you. So that's all guys, that's all what I wanted to tell you. And just take care of yourself and be happy, be healthy, and be careful before you take advice. Choose your own path. If you want, speak to 2-3 doctors, take second opinion and everything, and speak to very senior doctors who understand things without doing just test, those kind of doctors, and then you take your decision. And once you are once you start your medication, then have full faith and belief in your medicine. Only that will help you. So that's all guys, thank you for watching, take care.